Welcome to Project Health, a prostate cancer initiative powered by Focus on Diabetes. Fellas, let's talk about your health.
Hello, my name is Bridget, and welcome to Project Health. Today we have Dr. Matthew Ferroni. Dr. Ferroni is a well-trained and practices in all areas of urology. He specializes in minimally invasive surgery, including da Vinci, robotic and laparoscopic surgery for prostate cancer, kidney and bladder cancer, as well as treatments of benign prostatic hyperplasia, and endourology for the treatment of kidney stones, bladder tumors, and enlarged prostates. Dr. Ferroni is an active member of the American Urological Association and has published his research in many leading urology journals and remains passionate about investigating new treatment options and techniques to continue to advance the field of urology. In his spare time, Dr. Ferroni enjoys spending time with his wife and 2 children, soaking up the culture of Cedar Rapids and Iowa City. He's a passionate Philadelphia sports fan and has now embraced rooting for the Hawkeyes with family and friends. Go Hawks. We'd like to welcome Dr. Ferroni.
Thanks, Bridget.
Thank you for joining us today. We're excited to have you. So I gave your bio, but is there anything else you'd like to tell us about yourself?
Yeah, so thank you for that, for the introduction. As you said in the bio, I'm a practicing urologist here in Cedar Rapids, Iowa. Very passionate about prostate cancer because, and I'm sure we'll get into this quite a bit, prostate cancer is really a battle that we're not winning right now. And a lot of our efforts out of our cancer center and urology office here at Mercy is really about community awareness in terms of screening, in terms of treatment, really breaking down a lot of barriers for men to have access to care, to be screened for prostate cancer and early diagnosis. So that's really become a major part of my practice and day-to-day kind of initiatives here in Cedar Rapids and all of Eastern Iowa.
So you work at Mercy Cedar Rapids.
I do.
And you are a specialist in urology. So tell us briefly, kind of explain to our audience what the prostate is, what it does.
Yeah, that's a great starting point because I think a lot of times we assume that when guys come in here, they remember 8th grade anatomy and they have some idea what the prostate does, and most don't. They just kind of heard of it in terms of cancer and urination and stuff. But the prostate is basically a walnut-sized organ which can grow actually. In medicine, we like food analogies, so I guess it can grow to the size of a plum or even an apple as guys get older. But in general, about a walnut-sized organ that sits basically right in front of the bladder. What the prostate does, all the prostate does, is make proteins and things that help with sperm maturation and the ability of sperm actually to be able to fertilize the egg for fertility. So the prostate's sole function is really for fertility. And in many men that we see in urology, those days are over because these men are over the age of 50. And then after that point, the prostate essentially just becomes a liability. It doesn't really serve any purpose except for issues with urination as the prostate enlarges in majority of men, and the possibility of prostate cancer as men get older, 45, 50 and above.
Okay. So can we talk a little bit about prostate cancer screenings? What all does that entail? Like, what are the recommendations? When should they be screened? And how should a man go about that?
Yeah, so Bridget, this is a big Pandora's box because it used to be very straightforward prostate cancer screening, and it no longer is. There's a lot of, we could go into a lot of detail on this, but keeping it simple, prostate cancer screening has changed a lot over time. Unfortunately, about 10 years ago, there was data that came out that was very poorly done trials that basically concluded that prostate cancer screening was not effective to help save people's lives and allow men not to die of prostate cancer. And that turned prostate cancer screening kind of on its head. And a lot of primary care providers stopped screening for prostate cancer. There's been a big benefit or a big impact of that over the course of the last 10 years as prostate cancer rates have gone up and death rates have gone up. So it's kind of made us reevaluate prostate cancer screening, when to start it, how long to do it, and how often to do it. And there's some disconnection with a lot of guidelines that doctors use to practice medicine on all of those things. The basics of it are prostate cancer screening is generally done through a blood test called a PSA, which stands for prostate specific antigen. It's a protein that the prostate makes, and all normal prostates will make PSA. So having a PSA number or even an elevated number does not mean a man has prostate cancer, but it is a marker that we use to screen men for prostate cancer. The other component to prostate cancer screening is the feared digital rectal exam to feel the prostate. Now, that's still an important part of prostate cancer screening, but to be honest, data has come out in the last 10 years or so that the importance of doing a DRE is nowhere near as important as a PSA blood test in terms of finding prostate cancer. So there are many, many men who will stay away from the doctor's office for prostate cancer screening because they're afraid of the rectal exam. But if those same men were willing to have a simple blood test, which many of them are, at least that is a very powerful screening tool that we can use to assess whether or not they have a risk of prostate cancer. Most guidelines right now are recommending for average risk men, meaning they don't have a family history of prostate cancer and they're not African American, to start screening at 45 and continue screening to 75 on an annual basis. Now, men who have a family history or who are African American have a higher risk of prostate cancer, more aggressive cancers, and cancer being diagnosed earlier. So we want those men to start screening actually around age 40.
Well, you brought up a couple of interesting things, I think. Just the fact that some men do not want to be screened because of fear of a rectal exam. So thank you for telling us that a blood test is a good place to start, because we're learning that people are going to the doctor and they probably already are having lab work. And so this is like an additional test that just can be added to what they're already doing. So that's good to know. Can you kind of tell us?
To interrupt, but to that point, it often is, and men don't realize it's happening in the first place. So a lot of doctors will just add the PSA on, and men don't even know what that is or what it's looking for. And then they'll get a phone call and say, hey, your PSA is elevated. You need to see a urologist. And many of them won't come and see a urologist because it was never quite explained to them in the first place what that test was and what it was looking for. So yes, it's an easy test, but I do think we need to empower men all across the community to understand what this test is and to ask their doctor about it and know that it's being checked and follow that number themselves. So, kind of, we have this phrase, we say, know your stats, like know what your PSA number is and know what it is year over year. And if it's not being done, ask your doctor or seek out ways to have that PSA checked.
Well, you mentioned that just because it's an elevated PSA doesn't mean you have prostate cancer. Can you talk about that a little bit, or how would you explain that to a person who that may be the case, that their PSA is elevated? How does you explain it's elevated, but you don't necessarily have prostate cancer?
Absolutely. And that's sort of what makes PSA not the greatest screening test for cancer, because as all men get older, generally over the age of 40, 45, their prostates will start to enlarge. Not from cancer, just that's what happens with different growth factors and things. And the larger that prostate gets, the more PSA it makes normally on a day-to-day basis. So it's not uncommon for a guy to have a flagged blood test that says his PSA is high, but in fact, that man just has a very large prostate, and that's the reason why his PSA is elevated. So we have lots of different tricks and tools and different other tests that we do in urology to really characterize better if an elevated PSA is something that we are worried about from a cancer standpoint and that patient needs a biopsy, or if it's more likely that that elevated PSA is related to the size of the prostate, other things like infection, urinary tract infection. We never really want guys to have a PSA checked if they're having a urine infection, because that could significantly falsely elevate that number. Inflammation in the prostate is another big one. Inflammation is kind of tough. You know, it's a kind of a buzzword nowadays in medicine, but lots of diseases are basically fueled by inflammation, and the prostate can get inflammation that may or may not cause symptoms, but could also falsely raise that PSA up. So bottom line is, you know, if you get your PSA checked and it is elevated, it does not mean you have cancer. It certainly means we need to have a discussion and figure out what's going on. But it is not a diagnostic test that tells a doctor that you have cancer. Just like you said, Bridget, a good starting point.
So can you talk a little bit about this, what the screening recommendations, the impact that it has had on prostate cancer disease management?
Absolutely. So a little more detail, 10 years ago, I kind of alluded to one of the big governing bodies called the United States Preventative Services Task Force that comes up with guidelines for all primary care providers to follow for cancer screening, for diabetes control, high blood pressure, you name it. They come up with guidelines. They had recommended against prostate cancer screening, like I said, based on some poorly designed studies that we now know were not very well done and did not really show what they intended to show. But the impact of that was a guideline came out that all of a sudden people weren't screening for prostate cancer because there was this assumption that prostate cancer screening does not save lives. And over the course of the last 10 years, we have seen prostate cancer death rates go up about 5% per year over the last 5 to 10 years. So prostate cancer death, prostate cancer advanced disease, we're seeing so much more of that nowadays because now we're kind of playing catch up. Now that that's been reversed, and thankfully there is much more attention again on appropriate prostate cancer screening. There are many men who had a big gap of about 5-7 years where they did not have a PSA, and it was normal 7 years ago, and now it's through the roof and they have a very advanced cancer. And had we caught that man earlier, we probably could have cured his cancer. So it has had a big impact, but I think it also tells a good tale, a cautionary tale, that we cannot just make sweeping generalizations that we shouldn't do something that we all kind of feel deep down in our hearts as doctors is the right thing to do. And the rest of the community is coming along with that in the last few years for sure.
Yeah, I'm big about personalized care. And sometimes these blanket recommendations where it's not like a one shoe fits all kind of thing. And so I am glad to see how it is changing again. Like we see the effects of it, but we are really putting into action some measures to change that. How can a person or a man assess if they're at risk or that they need to be screened?
That's a great question. So let's talk a little bit about just sort of the definition of screening, right? It's kind of a buzzword, but the whole point of a screening test is to find a problem before it causes any symptoms. And I think men don't usually understand that, or sometimes don't, where I'll have a guy come into my office with an elevated PSA and he'll say, there's no way I have cancer. I have no symptoms. I feel fine. I have no issues with urination. I'm doing great. Well, that's the whole point of a screening test, is to find cancer when it's so early and so small that it's not causing symptoms. By the time a cancer causes symptoms, oftentimes it's too late. That cancer is too advanced and is starting to spread beyond the ability to treat it or certainly cure it. So all men really should be screened. Now, it goes back a little bit to what you said a few minutes ago. It's not all men. It's men who have a reasonable 5 to 10 year life expectancy, meaning that it is not a blanket approach. It is individualized. Men who are in their mid 70s, mid 80s, who have many other medical what we call comorbidities, things that like diabetes, heart disease, and probably have a pretty limited 10-year life expectancy, actually don't need to be screened for prostate cancer any longer, because even aggressive prostate cancer does take a while for it to grow and potentially cause death. So for younger guys, it's very, very important that have a 20, 30-year life expectancy. But as that life expectancy gets closer to 5, 10 years, then yeah, we do back off a little bit, because even if we found cancer at that point, we probably wouldn't treat it very invasively, because those men have other more important medical problems at that point.
Mm-hmm. So is prostate cancer curable?
Absolutely. And that really is the cornerstone of all this. Prostate cancer, if found early with early stage and pretty low grade, can certainly be curable with surgery or radiation treatments. And it all depends on when we find it. If we find it too late and the cancer is already spread outside the prostate, then no, oftentimes we can't cure it, but we certainly have good ways of treating it and kind of keeping it at bay for 5, 10 years, so that men, like I said before, can sort of die of other things, more natural, other medical issues or natural causes, and not of their cancer. But the earlier we find cancer, the best shot we've got to treating it. And the other thing to always think about is, the younger men are when we diagnose their cancer, the less impact that some of the treatments we do to cure cancer, like surgery and radiation, is going to have on their well-being, the less side effects they're going to have. Younger, healthier guys can get through surgery much easier with minimal complications than older men who, have other medical problems and may not be good candidates for treatment.
Okay. So I kind of want to shift the conversation just a little bit, but would like to talk a little bit about how prostate cancer can disproportionately affect certain populations. We hear a lot about how prostate cancer, Black men may be diagnosed with it at a higher rate. They may die from it at a higher rate. So can you tell us a little bit more about that?
That is absolutely true. Yeah. So African American men have a 2-time greater risk of not only being diagnosed with prostate cancer, but of dying of prostate cancer. So the statistics we give all men in their lifetime have about a 1 in 8 chance of being diagnosed with prostate cancer. For African American men, it's 1 in 6. So 1 in 6 men in their lifetime. Now, there are 2 main reasons for that. The first is basically just genetics. Certain genes are expressed more in certain populations, and African American men tend to have genes and gene mutations that may lead to more aggressive cancers and cancers that grow earlier in their life. So that's certainly a big component, and that's not essentially very modifiable. The genes are what they are. But the other aspect that is very modifiable is access to care. So we know that underserved communities that don't have very good access to medical care and don't have good efforts in place to educate men on being advocates for their own care, stay away from the medical community and aren't getting screened and don't have the channels to get screened the same way as other men do. So it's a little bit of this delayed care or delayed screening that leads to higher grade and stages of cancer diagnosed for a lot of men in sort of underserved communities.
Are there any preventative measures that men can take when it comes to prostate cancer, or even what they can do for better prostate health?
Oh, absolutely. If you asked me that question 5 years ago, I had a stock answer of just like, no, not really. The prostate is what it is, and you're either going to get it or you're not going to get it. What we're learning, not just for prostate and prostate cancer, but for all aspects of health and wellness, that diet plays a huge role in cancer biology and the ability of the body to fight off cancer itself without it ever becoming a problem. There has been a shift, and there's been a lot of research that a more plant-based diet. Now, I'm not on here to tell everybody they need to become a vegetarian or a vegan tomorrow, but what we do know, I'll give you an example, and this is the example that I think always people, it's mind-blowing, and they always remember this. There was a very good study done out of the University of California, San Francisco, a couple years ago, that men who eat 3 servings a week of broccoli or cauliflower, Brussels sprouts, what we call cruciferous vegetables, but broccoli is kind of the easiest to remember. 3 servings a week of broccoli have a 50% reduction in the incidence of prostate cancer.
Wow. So I'm going to start being like wives out there. Hey, you see here the groceries you need to be picking up.
Yeah, I mean, it's not a plug for the grocery store produce aisle, but I mean, it really, no medicine does that. There is not a single medicine, a single supplement, a single anything that we can give patients that can reduce cancer risk by that degree. And it's just one example. There are many other examples. But the idea is that most cancers, and prostate cancer is not unique, are fueled by inflammation. And things that have antioxidants and things that are overall, healthy, help the body to fight inflammation, and that leads to less cancer. The other thing we know is dairy. Actually, cow's milk dairy, also by eliminating that in the diet. And nowadays there are so many alternatives. You go to a dairy aisle, milk aisle, there's soy milk, there's almond milk, there's oat milk, and all the different yogurts and ice creams come in all these things. Eliminating cow's milk dairy from the diet can have about a 45% reduction in prostate cancer. And these things are all additive too, Bridget. It's not like they work in a vacuum. If you do 2 or 3 of these things together, you may reduce your personal risk by 60, 70% by just making a couple dietary changes. And again, this sounds hokey, and there are a lot of old school doctors who hear this stuff and kind of blow it off because it's not a medicine they can prescribe, or something that's dominated by big pharma. It's basically just food is medicine. But there is a lot of good evidence that these strategies can be helpful, especially for people who are higher risk, who have a family history, who are African American, who we can mitigate that higher risk by having them do a couple of these things so that their risk can be reduced.
We've had a lot of conversations about diet over the past week, or at least about the foods that we put in our body and how it fuels our body, how it promotes health depending on what you're doing. So I'm glad you said that, because this isn't the first conversation we had about in terms of how diet promotes health if you're doing it better than what we are used to in this country. I had been approached by a guy that wanted to know, what does red meat play into disease?
I always shy away from that one because it is Iowa, and but we know that red meat has the same impact. Honestly, that we tell men, now look, everything in moderation is a phrase that everybody has heard. This does not have to be a complete elimination, but we work very closely with our dietitians here at Mercy and have come up with basically a prostate cancer diet that we recommend for our patients, not only to prevent prostate cancer, but men who have prostate cancer. These interventions can help actually treatments like radiation work better. Red meat is on the list, as is processed meat. So we tell our patients to try to limit 1 serving a week of red meat. And when we talk about a serving, we're kind of talking about the size of it. We're not talking about a 64-ounce.
Effective on that serving size.
It's about 6 servings in one. Yeah. a palm-sized serving of red meat, and that's it, one a week. Processed meats like hot dogs, anything cured meats like salami or pepperoni, all have carcinogens in them that have been linked to prostate cancer. So I don't know. There's probably people that are going to watch this or say, well, what am I supposed to eat now at this point? And again, it's all about moderation and limiting the real heavy hitters. But a more Mediterranean style diet with lean protein like fish, even chicken and poultry is better, certainly than red meat and processed meat to get protein.
Yeah, I like to tell people that, it's not about eliminating everything. We are not saying because people really do have this sense of, well, what do I do now? They're taking away everything I do. I don't know what to do. So I'm glad you kind of say it's not saying you going cold turkey on just dropping everything and trying to just completely shift. But if we can cut back and really look at portions and things like that, it kind of gives you a way to ease into a habit change.
Absolutely. And Bridget, there's a reason I start with the broccoli, because it's easier to be additive than subtractive, right? I think most guys will say, I can do that. I can add 3 servings of broccoli, but don't take my hamburgers away. And if you're going to do one thing and they're all have the same impact, start with the broccoli, get that going, and then start to make incremental changes, limiting the bad stuff, but start with just more of the good stuff.
Mm-hmm. So, Dr. Ferroni, can you talk a little bit about some of your work that you're doing and bringing awareness to prostate cancer prevention?
Absolutely. So, like I said before, we feel strongly that we need to educate men to be advocates for themselves and to not rely always on their doctors. It's not to do the best thing for them, but like I said at the beginning, guidelines are different. There are some prostate cancer guidelines that still recommend starting screening at 55 instead of 45. That's a 10-year gap that there could be a huge difference in finding cancer early. So we want to educate men on the importance of being screened. And if they ask their doctors and their doctors say, no, you don't really need that, well, maybe find another doctor or get another opinion, unless there's a very strong reason why someone's telling you not to. In the community, we're just trying to raise awareness by different health fairs, being a part of spreading that message. Anytime there's a health fair in Cedar Rapids, in Iowa City, we try to be there promoting prostate cancer screening, starting conversations. We sponsored a baseball game at the Cedar Rapids Colonels, which is a minor league team here in Cedar Rapids. And Bridget, I know you and Terrence came to that, and we had a great time. Again, just awareness. The biggest thing for us, though, is awareness is one thing. How do we actually get guys screened who are not being screened? So we've come up with actually a website that men can go to, that they can fill out a form, and we can look them up in our system if they've ever touched Mercy Hospital before and see if they have a PSA on record, see if they are being screened. And if they're not, we are more than happy through the urology office to order a PSA blood test for them to get through Mercy so that we can actually make sure they're being screened. And that's huge. I mean, that's been really big for us. There's actually there's a link. I don't have the website offhand. There's a QR code that is on all our materials to screen. But if you go to the Mercy Urology webpage, just I think it's Mercy Urology. Let me just make sure I have the right link here. Through our regular Mercy Urology Clinic webpage at www.mercycare.org. And if you click on the link for prostate cancer on the left-hand screen, there is then a website that says need a PSA screen. And you can click the link to start there and fill out that form. So that's very helpful. So again, that's www.mercycare.org/urology.
Well, thank you for that, Dr. Ferroni. We really appreciate the information that you gave us today about prostate cancer, cancer prevention. and how we can connect to Mercy, Cedar Rapids, and then kind of that they can go onto the website. You can actually kind of just look and see if they've had a screening and possibly can get people screened early. So that's great. Um, is there any final thoughts that you have before we wrap up?
I think we covered a lot today, and I think
Mhm.
that it's so important. Like I said before, this is a battle we don't feel like we're winning, but we can. I mean, I am a firm believer, as sort of pie in the sky as this sounds, that no man should die of prostate cancer. 35,000 men a year in the United States die of prostate cancer. And unless there's a man who absolutely refuses to have a test done and not see a doctor, or, for personal reasons, just does not want to be screened, we have the tools to find prostate cancer early and cure it so that no man needs to die of prostate cancer if we're screening the right way. So my goal, at least in the next 5 to 10 years, is to really start to see that mortality rate of prostate cancer in our own community start to significantly go down, because that'll prove that what we're doing is working.
Absolutely. Thank you so much. And thank you, Terrence, for working with us. But Dr. Ferroni, we really appreciate you taking the time to help us spread the word about prostate cancer screening. And I think at heart, we both have the same goals in mind. And it really is about health promotion, disease prevention, and to really get people connected back to care. And so that's kind of what we're here for. And we are happy to be a partner with what you're doing, and hopefully us working together that we can start seeing this trend in a good way.
Absolutely. We're just getting all of everybody together who is passionate about this, building our team all over Eastern Iowa. So happy to work with you and keep this momentum going for sure.
Awesome. Thank you so much.
All right. Thanks, Bridget. Take care. Thanks for having me.
Yep. Take care. We'll
All right.
see you later.
Sounds good. Yep.